Okay.
Okay, we are here at Michigan Spine and Joint Center 2022. Happy New Year, Dr. Debo.
Happy New Year.
Okay, so we want to discuss today one of the most common complaints that we get in this practice and really throughout the world, it's seen. And as a patient, this is something I actually personally struggle with from time to time, headaches. So the complaint that I've got is I've got a headache on the side of my head going behind my eye, and it's just relentless.
Okay.
So I'm here for help.
All right. Hey, welcome. When did this pain start?
It started pretty much after a long day of work.
Okay.
I was working on my laptop,
Okay.
kind of looking down. I was on a low desk,
All right.
and just like that, and it just gradually built up
Okay.
someday last week.
I got you. Could you tell me the symptoms? Where do you feel the pain? Where is the discomfort?
So I'm feeling it pretty much like in my left temple,
Okay.
behind my left eye,
Okay.
and it spreads down into the kind of the base of my skull over there.
Got you. Do you have any numbness and tingling shooting down into your fingers?
No, nothing at all.
Very good. So you said this pain started a few days ago after using the computer, right?
Right.
Do you feel pressure at the base of your scalp?
I do.
Is
a lot
it
of pressure.
on both sides or just one side?
Feels pretty much on both sides, but maybe a little more on the left.
Okay. Is there any dizzy spells with it?
No dizziness.
Very good, very good. So what I'm gonna do is I'm gonna step up. I'm gonna take a look at the neck, see what's going on, and then we'll go from there.
Perfect.
All right.
Can you explain to the audience why you asked me those questions about dizziness and pins and needles and numbness and tingling?
So we just want to make sure we rule out other potential problems, which could be a disc herniation, or it could be a vertebral artery problem. So make sure that we rule all that out before jumping into your exact situation.
And that's typical to all chiropractic appointments. We're very careful and methodical, ruling out those red flags and making sure we do things in the correct clinical order.
Absolutely, we call that FBI. So you got to do a really good investigation and hopefully just narrow things down. That will help, draft out your treatment plan. And hopefully, will help the patients out too.
Right.
All right. So I'm just gonna step right here for me. All right. So what I'm about to do is what we call palpation. Okay. I'm just gonna feel for the neck, see if there's any discomfort, if there's any restriction. All right, sir. This is what I'm gonna have you do. I'm gonna have you turn your neck to the right, sir. Good. Now go ahead and turn to the left. Very good. Just going to bring your chin down to your chest. Good. Just bring your neck all the way back towards me. Good. Go ahead and bring your heels to your shoulder. Good. Bring this to your shoulder. Is that causing any pain or discomfort, sir?
Stiffness on that side.
Okay. So I'm going to proceed just to kind of pull on it, see what's going on. So he's got extremely tight muscles at the base of the scalp. Seems to be worse on the left. So this is what we call cervicogenic headache, where you do have a significant amount of pressure built up at the base of the skull, which could cause a nerve irritation or impingement. There is another group of muscles called the suboccipital muscles too. When these muscles get extremely tight, it could cause a little bit of a nerve irritation, sending referral pain in forms of headaches, to the skull. Hence, cervicogenic headache. All right, so that's what's going on, sir. It seems that probably from working on the computer with bad posture, that could cause significant neck stiffness, which in turn will cause headaches.
And then treatment-wise, what are we going to be doing today?
Okay, so absolutely what we're going to do is we're going to do what we call manual therapy, which is obviously the muscles are tight. We want to work the muscles. We're going to stretch it out. We want to minimize the pressure at the base of the skull so that way the nerves could be happy. All right, so we'll stretch it out. We do a little bit of what we call myofascial release technique, which is that using your hands to roll out the specific type of area of the muscle that isn't doing well. In other words, maybe the knotted area in your muscles.
Get some blood flow through
just
there.
to get the blood flow through there. And then there's something called chiropractic manipulative therapy or spinal adjustment, like some people love to call it. So if there is a joint restriction in the neck, doing that will free things up a little bit, which will in turn help with your flexibility and will reduce the headaches. So I'm just going to demonstrate that to you real quick.
Perfect.
So what I'm going to do is I'm going to have you go lay face down on this table. All right, so first thing I'm gonna wanna do is I'm just kind of feel the joints out, make sure we're moving. So right here, you're not moving. I could just feel you're pretty locked because the joint is prominent. All right, so that, and then like I said right here, you do have significant tight muscles, predominantly on the left. Again, we're gonna work that muscle out. We're gonna do some stretches. Obviously, we don't have that much time, so I'm just gonna kind of speed through it so you guys get an idea of what we try to do. Okay, so I'm just gonna work the suboccipital muscles out. Okay, then I'm just gonna slowly work the cervical paraspinals out and also the traps. All right, like I said, guys, what we're trying to do is we try to loosen the muscles up to take pressure off of the base of the skull. All right, I'm gonna have you flip on your back for me real quick. All right, so I'm just kind of play around with the base of the skull right here. See, we wanna make sure we work the suboccipital muscles out. Good. And then we're gonna do what we call passive range of motion exercise, which means we're just gonna stretch this out, hold it 5 seconds. We're gonna bring it to the other side. We're gonna stretch it out, hold it 5 seconds. We're gonna bring this up, massage it out. All right, and then we're gonna stretch. We're gonna stretch, and then right here. So there isn't any contraindication to spinal manipulative therapy. So it cleared the protocol. So I'm gonna go ahead and adjust this neck, okay? So right here, it's got a restricted joint, which means that the joint is locked. It's not moving. There isn't any mobility in it. So what I'm gonna do is I'm gonna unlock it. All right? Can you feel something here, sir?
Oh yeah.
So I'm gonna slowly just turn and induce controlled force into the joint. Good. We're gonna go the other way, right there. We're gonna do the same, okay? Controlled force. I'm not yanking his neck. I'm just slowly doing it. Good. Come on up for me, sir. And then I'm gonna do my manual therapy. We're gonna stretch this out. We're gonna stretch it out. Then we're gonna go the other way. We're gonna stretch it out. And that's pretty much it. Obviously, we don't have that much time, but this is just the brief summary of what we do in clinic.
Can I give you my money? Thank you, Doc. That was
All right,
great.
it's good.
Very good.
Good.